Hey everybody, I'm Dr. Max Orris at Agape Family Chiropractic. Welcome to our first Zoom call that we're doing. We're doing this with Dr. Melissa Georgevitch. We're doing these Zoom calls to bring more value to you, to the Eureka area, to the community everywhere around here, so that you know your options and different things in the community that are good for you and things that you can add to your lifestyle. So Dr. Georgevitch is an animal chiropractor, which is awesome and totally unique. But before we dive into that, let's hear a little bit more about you. Where are you from? What got you to this point?
Sure. Thanks, Dr. Max, for having me on. This is a great informational tool to spread across the community, so I appreciate that. Again, my name is Dr. Melissa Georgevitch. I'm from Pacific area, so I grew up from there, went to Logan, just like Dr. Max did, and came back to my hometown. So this is really great. Yes, I'm a chiropractor, and yes, I'm a chiropractor for animals. So a little bit about, you want to go in about that now, or should we go back to like schooling? What do you want to do?
Whatever you want to talk about.
Okay, so I'll go with schooling. How's that sound?
Yeah, sounds great.
Okay, so I went to Logan University for the Doctor of Chiropractic program. So I got certified in people. And then from there, I went to Options for Animals, which is an animal chiropractic school in Kansas. And got certified by the International Veterinary Chiropractic Association. So IVCA certified.
Awesome. So that's extra training on top of going to Logan.
Yes, absolutely.
Okay. And can any chiropractor just be an animal chiropractor if they want to?
No.
Oh,
Nope.
okay.
So you'll want somebody. Yeah, good try. I know what you're trying to do there. No, you'll definitely want to have someone that's certified. So there's two governing bodies that you can have for certification in the state of Missouri. You can have either a chiropractor or a veterinarian that's gone through the additional certification and is certified by either the International Veterinary Chiropractic Association, which is the IVCA, or the American Veterinary Chiropractic Association, which is the AVCA. No real significant difference between the two, but you'll want somebody certified in one of those avenues.
Okay, awesome. So what drove you to want to work with animals? I know you do work with some people, but why specifically animals?
Sure. So I've been in the vet field for almost 10 years now. So I started off as a kennel assistant, worked my way up through vet tech assisting, stuff like that. So I've been around animals my whole life. I've had animals at home also. So it really inspired me to bring chiropractic to these animals to make a difference in their world.
Awesome. So a lot of people, and we're going to show this on our Facebook page and everything, they understand the importance of chiropractic for people, but why is it important for animals to get adjusted?
Sure. So a lot of them, just like us, they need chiropractic care too. So they have spines that are influenced by the nervous system. So just like us, we go through and, we run, we do all these different activities, and we can get to where we have subluxations from that. Horses, dogs, they're no different. So they go through everyday lifestyles. They have stressors that impact their nervous system. So they represent that a little bit differently than we do, but they certainly can benefit from chiropractic also.
Yeah, absolutely. They have a nervous system, right?
You bet. Let's check that.
Okay. So along with that, you said horses and dogs. Can you work with other animals?
Sure. Yeah. So for the cat people out there, they're wondering, what about the cat? So the cats will just tell you if you can adjust them or not. So they have their own attitude, as we all know. So I see dogs, cats, horses primarily. I also have experience with goats, pigs, cattle. So I have quite a few like in the show ring. So the 4-H, either cattle, pigs, that sort of thing. I think that's about it. I've seen quite a few different animals.
Any snakes?
No. No way. No.
How do you know, how would somebody know if their pet should see a chiropractor?
Sure. Yeah. So we're going to primarily go over dogs and horses because that's the primary animals that I see, but you're going to have to watch them from a biomechanical standpoint. So they can't tell you, hey, dad, mom, whatever, that my, left paw hurts or something like that. They can't tell us those things. So we have to watch them. How are they walking? Are they limping? Are they getting in and out of the car differently or having difficulty doing that? Getting on and off the furniture? Are they not wanting to and they used to? Are they limping more frequently now as far as like when they get up from a laying down position? And now they are getting up and now they're really sore. So it sounds more for dogs like the older ages and stages, but it's for puppies too. So we look at the puppies and are they tumbling around playing with other puppies or with the kids, that sort of thing. Having those different motions and moving their bodies in different ways can all have those impacts to where we can watch them visibly that they need to be adjusted. For horses, so we have quite a few rodeo instances for an example. So the barrel, are they not wanting to go a certain way? Or horses in general, are the leads off? Again, lameness is an issue. Different things, not flexing at the poles. So different things that we're watching for that we notice they're not quite right, but we're not sure why. It's really good to check the nervous system, check them spinally, and see how are they moving.
Right. Okay. So like you said, their movement or any big changes in their habits or how they're moving would be a big.
Yeah, and they can be painful too, but we don't like to go down the pain route. So we like to more go off of function and how their nervous system's functioning, how they're overall functioning. Yes, pain can be a symptom of that too, but it can also be for wellness care. So I see quite a few that they understand chiropractic just like your patients do, and they want to have their animals adjusted to make sure that they're flowing, the nervous system's flowing like it's supposed to, and they can work like they need to.
Awesome. Yeah, that sounds great. I know your cards fly off our shelf too. So, so take us through an adjustment with an animal. How do you do it? How do the animals respond?
Sure.
What are the things you're looking for? That kind of stuff.
Yeah. So we'll start with the dog. So go through first, and I'll watch the dog walk, see how, if they're limping, if they're carrying themselves to one certain way, that sort of thing. Go through and do some neurologic tests just to make sure we're good to go for adjustments. If the veterinarian's on staff, which in Missouri, we have to be under vet supervision as a chiropractor. So a lot of times, I want to talk to the veterinarian and say, have you referred this dog? Why? If not, this is what the owner is seeking. And I want to see if you have any, past history. Maybe you've seen this dog for back pain in the past or something like that. So I'll go through and get the history, watch them walk, do some neurologic tests from there. Go through each vertebrae in their back and see how that's moving. So put some motion into each one of those where it's needed. So I start down by the tail and I work my way up to the head and just motion each vertebrae and put some extra motion into it. So palpate each vertebrae, motion where we need to. Very similar as we do for the people patients. So they either lay on the table or depending on how they get adjusted. And we palpate which segments need that extra love and put some adjustments in there and go from there. The dogs usually respond pretty well. They are standing for the adjustments primarily. So you have to be able to have them standing, put one hand kind of underneath for support, and the other hand just kind of goes through and palpate. For the horses, I stand on these pretty big blocks. So you can't tell how tall I am in this video because I'm sitting down, but I'm 5'4", and I claim that 1/2 inch, so 5'4.5", and I have to stand on these pretty big blocks to go ahead and adjust the horses. So I have to be above their spine. And doing so, I can get the right range of motion to go ahead and palpate each segment, again, starting from the tail, working my way up, and see which areas need to be adjusted and go from there. And then you can go through also for dog and horse, kind of combining them, but motion the neck, see how that's moving, and adjust where appropriate also. And then same with extremities.
Okay. What's the biggest horse you've ever adjusted? How many hands?
The Clydesdale, I think it's like 18.3, I want to say. Yeah. Yeah.
That's awesome. So how do the animals respond?
Sure. They respond in general really, really well. So if we have some with what we call in chiropractic a hot low back, those ones are a little bit more nervous. They're a little more apprehensive. But in general, all the animals will stand there really well, just kind of like, oh, I can handle this. This is good. And they do just fine. A lot of times the dogs or horses will go through and have like a licking or chewing sensation. And that's normal. So that's that endorphin release that we get with the chiropractic adjustments. So those are common symptoms that we see. Commonly, they're real tired after an adjustment. So again, those endorphins are released, that nervous system's flowing like it's supposed to, and they usually want to rest afterwards, but they respond really well.
Yeah. So I'm going to spring a question on you here that I didn't give you in
Go for
advance. What is the weirdest or funniest experience you've had with adjusting animals?
Probably a pig. That would probably be the funniest. So going through and adjusting, there was only, I think, 2 or 3 segments that I had to adjust on this pig. So keep in mind, and I don't know pig terms, but it was one of those pigs that they help with, or they do like training. So they're teaching it how to sit. So they'd go through and like try and, go over the nose type of thing to try and get it to sit down. And I was at a barn one day and they're like, hey, can you look at this pig? Like, I'm like, oh, sure. It's got a spine. Why not? So they told me kind of what was going on. We did a little bit of an evaluation, and each time there's 3 spots that I adjusted. Each time it squealed, and I jumped. I'm like, whoa, wasn't expecting that. But that was probably the funniest, or odd type of thing. But it was really cool, and yeah. I had a lot of fun, and the pig responded really well. So
awesome, good deal.
Yeah.
So, before we ask how people can get a hold of you, any other stuff just in closing that you want people to know about you, about animal chiropractic, about anything
Sure. I would say the biggest thing, make sure you have someone that's certified to go ahead and adjust your animal. So again, you want a chiropractor or a veterinarian that has one of those certifications, either ABCA or IBCA. Having that done, I prefer manual adjustments. So there are some times where people use an instrument such as an activator, and there's no real significant studies done with the animal chiropractic as far as methods to use for them. So yes, they've been researched on, but there's no actual method for those animals. So I would prefer some sort of hands-on active adjustments there. Biggest thing is just don't try it at home. Let a professional do it. So you're going to have to watch your dog or your horse, how they move, how they present themselves, and see, is this something that could work for them? So I work in conjunction with the veterinarians. I'm not going to take them on or off any medications. I can't do that as a chiropractor anyway, but this is complementary to their traditional vet medicine. So definitely something to consider as an alternative method, just to kind of keep them healthy. And like I said, not just for the aging. I've seen anywhere from a 2-day-old horse to up to 20-something years old. Puppies I've seen a couple of weeks old, all the way up to senior years and quality of life exams. So definitely good for everybody, definitely good for wellness, but make sure you have a trained professional on your side.
Awesome. That's great advice. Definitely not something you want to try at home.
Please don't try at home.
So what is the best way for people to get a hold of you? I know you work at a few different places.
I do. Yeah.
Yeah. Where are they at? How do they get a hold of you? What's the best way to get your animal seen?
Sure. So you can actually go to my website, and that would have all of the information on it. So that would, and we'll post it up on the screen also, but that is www.mgeorgevitchdc.com. So Georgevitch is Georgevitch. And then on there, you can see the 3 different clinics. So again, I'm with 3 different clinics, 11 veterinarians total. Closest one to Eureka would be Fox Creek Veterinary Hospital in Wildwood. Second one would be St. Charles at Elm Point Animal Hospital, and then Cuba Vet Clinic in Cuba, Missouri as the third. So I see small and large animal. No snakes though. Don't ask me to see a snake. And you can call those clinics for scheduling. So we'll get that information up to you guys. So that way you can go through and look at it. Also my Facebook page, so you can search similar to the website, the M. Georgevitch DC, and that'll pop up my doctor Facebook page, and that has some important information on there too.
Awesome. Good deal. Thank you very much for coming on here. I hope, people reach out to you from this. It's a great resource. Just like with people, like I said, animals have nervous systems, they have spines, they need to get checked, make sure they're functioning the way they're supposed to. It's exactly how you do it, and I love it. So again, thank you for coming and sharing that with us.
I appreciate you sharing the info. It's awesome. Spread the word. Get all those animals adjusted.
Absolutely. All righty. Everyone have a good day.
Thank you. Bye.